This week's program was filmed at Medical City, Dallas. Founded in 1974, Medical City is recognized for its state-of-the-art medical facilities and commitment to excellence in patient care. Located in Dallas, Texas, the hospital's medical team consists of more than 1,150 physicians, many of whom are recognized as the world's best in their specialties. Medical City, specialists in life. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome everybody to Platforms, the life-lifting news program for women. I'm your host, Siobhan Palmer. This week, we're delighted to welcome our guest, Dr. Joseph Kuhn. Dr. Kuhn is an attending physician here at Medical City, Dallas. He received his MD with honors at the University of Texas Medical Branch in Galveston. He is the current president of the Texas Association of Bariatric Surgery and has won numerous outstanding teaching awards throughout his career. He is recognized as one of the top bariatric doctors in the state of Texas. Dr. Kuhn also serves as the Assistant Director of Surgical Education and Medical Director at WLS Surgical Associates here in Dallas, Texas. Dr. Kuhn, welcome to the show.
Thank you very much.
I'm sorry that you haven't accomplished much in your life. It's a pleasure to have you on the program.
Well, it's a delight to be here and try to help any way we can.
Thank you so much. I want to start with, in layman's terms, because just the term bariatric, why don't you explain to our audience what that term means?
Bariatric is basically related to weight loss,
Okay.
and so, or to obesity. And so it's the surgery that is designed to help with weight loss efforts.
You know, I know that obesity is a terrible, terrible problem in the United States. How has the incident of obesity been rising in the last few years? I'm sure your practice has seen a remarkable jump.
There's been just a steady increase in the rate of obesity across the entire country. And when you look all across the world, westernized countries, you'll see the same rise. They're just about 3 years behind us.
What are the main factors why this is happening? Because there's some great education out there, yet people are still...
I think the key question is what causes obesity and why is it happening? Unfortunately, the vast majority of the population believes that it's the fault of that person and that it's simply a matter of willpower. And what we're finding is more and more that it's related to genes. And they've identified 8 or 10 genes already that either code for hunger or they code for your metabolic rate. Even when we find patients, for example, that have lost all their weight and they're thin, and then we measure their metabolic rate, it's still very low. They're not burning calories.
Interesting.
So genes are a big part of it. The other part is readily available food. You think about 50, 70 years ago, you might be in the Old West and you might be able to eat once a day. And so you would eat, your stomach was a reservoir. It held your food. Nowadays, food is readily available. So food is readily available. We have built-in genes that we're designed with that tell us to eat when the stomach is empty. The other thing is the calorie density of food is so high.
I was just going to bring that up. I mean, so many processed foods. You see these fast food restaurants on every street corner in the United States, and just if you break down what's in these processed foods, it's really frightening. But is it true, I've heard that these processed foods have some kind of signal that actually makes people more hungry as a result of eating that type of food?
It may not be the signal, but the sucrose, the corn syrup, the corn derivatives, they all have a tendency to rise your sugar level up, it comes back down, and you tend to be hungry again soon after.
Right, right. Let's talk about, going back to bariatric surgery, and we're going to take our audience through the various procedures that you and your team do, but this is considered, quote unquote, a life-altering procedure. Why is that?
Well, it's life-altering because it does change the anatomy of your stomach in general.
Okay.
The bottom line, all the procedures that we do change the reservoir size. So when you eat, you have a tendency to feel full early. And most of us, when we eat, we do enjoy the flavor of food, but it's that feeling of fullness you get when the stomach is full.
Right.
And you feel, you've had a big buffet, you go lay down, you feel good. So these procedures basically change the size of your stomach. And it's important to understand that your anatomy is different. It's life-altering.
What happens when you eat too much and you actually extend the stomach, and does that cause more hunger as you stretch that stomach lining, or is that just kind of a myth?
It's kind of a myth. I mean, the stomach itself, when we operate on morbidly obese patients who are very overweight, their stomach is still normal size. You can develop an awareness of it so that you're binge eating, so you're eating a lot at one time, and you can lose the sensitivity for when it's full.
Right.
So there's some truth to the fact that you can lose the sensation of a full stomach, but the actual stomach itself doesn't stretch.
And I think in the last few years, many of us have friends that have decided to do gastric bypass, which we'll talk about in a moment, or the lap band. But one of the things that you really push on your website is that disciplined follow-up. Once somebody takes that step, disciplined follow-up, it's a lifetime of follow-up and procedures for this to be a successful procedure. Why is that?
Well, what we've learned from other old operations, if you just operate and then the patient goes off on their way, it tends to lead to failure, because people will tend to eat foods that are comfortable.
They'll go back to
They'll
the
go back
habits,
to old habits. And so all of the operations require follow-up. And for us to be, for example, a bariatric center of excellence, a top center, you have to commit to following patients for at least 5 years.
5 years post-op, wow.
And really longer after that. I mean, our feeling is that the patients have a relationship with us wherever they are and at any time.
Right. And we'll talk about this later on this segment. It's a very integrated approach you have here at Medical City Dallas in terms of the patient care, which is very interesting. Let's talk about the various procedures. We'll start with one that many people are familiar with in the news, gastric bypass. And this is a pretty radical procedure. Why don't you explain in layman's terms what that is?
Okay. Gastric bypass has been around for 25, 30 years. And
it's been around that long? That's okay, okay.
So it involves dividing the stomach with a row of staples. So we don't cut anything out, but we divide the stomach, so now there's a small pouch in the upper stomach.
Okay.
Food goes into that small pouch, and then we construct the small bowel to where it's plugged into the pouch.
Into that smaller pouch, okay.
The lower stomach no longer gets food, it gets bypassed. So that's why we call it gastric bypass. So the stomach is bypassed. When food goes into the small pouch, it helps you feel full, and then it goes down into the small intestine. It is a procedure that works probably 97% of the time, so it's very reliable. It's got the longest track record in terms of experience. As you said, they're still essential that you maintain follow-up, that you come back and talk to your doctors, and that you eat to where it works best for that surgery.
Right. Now, what happens if somebody eats too much food? I mean, because you've made that upper part of the stomach so small, you can't really force. There's only X amount of ounces that can go in at a time. What happens from a physical standpoint if somebody tries to eat more than that pouch can hold?
What patients describe is just exactly what you would describe if you went to a buffet and had too much to eat, but then you had 2 extra servings.
Yeah.
And rarely you would throw up.
Like a Roman vomitorium.
Well, but what you would learn very quickly is that I'm not going to do that again.
Yeah.
So you get that sense of fullness. You learn that quickly, and typically you'll achieve that with, you know, roughly 4 ounces of food.
Right. Now, what happens to the other part of the stomach? Does it atrophy like a muscle that's not used or something? Does it kind of wither or what?
I think that's the most common question we get. The lower stomach stays right where it's at. There are nerves and blood vessels that
It's still feeding into it.
Still feeding into it. When you put food in your mouth, the vagus nerve stimulates that acid to secrete acid. It still thinks it's working. We can go back laparoscopically now and hook them back together. Takes a little over an hour, and the stomach, even 10 years later, would just pick up where it left off and continue to work.
Interesting. Hold that thought, Dr. Kuhn. We've got to go to break, but when we come back, we'll continue this conversation. We're going to talk about another procedure, very popular, called lap bands, correct?
Lap band.
Okay. Folks, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll be back in a moment with Dr. Joseph Kuhn with Medical City Dallas.